latest.
And tonight we're looking at acquired immune deficiency syndrome, or AIDS. It's a story that isn't going to go away. Certainly not when just about any death from AIDS supplies afternoon newspapers with copy. Rock Hudson's illness is a major story even for serious newspapers. So while science tries to prevent or cure the disease, we're left with the problem of what to do about it. We have a national AIDS task force and every state has an AIDS advisory council. New South Wales proposes to make AIDS a notifiable disease, and the National Task Force met last week to discuss ways of controlling the spread of AIDS through prostitution. It's also considering Queensland's legislation which compels AIDS carriers to inform their sexual partners that they are carriers. So with us for tonight's discussion we have Professor John Dwyer of the University of New South Wales and in charge of an AIDS clinic.
Good evening.
Terry Goulden, coordinator of the AIDS Counselling Service.
Good evening.
Dr. Julian, director of the Sydney AIDS Clinic in Albion Street.
Good evening.
And Dennis Altman, author of a forthcoming book on the politics of AIDS.
Good evening.
Thanks all of you for joining us. But before we begin, here's Sue Smith with some of the background.
Liberation and sexuality, permissiveness and the sexual revolution. Anything goes. In an age of frankness, for 25 years, sexual mores have been rewritten. To many, marriage is quaint and monogamy is old-fashioned. Changing sex partners is as casual as changing supermarket brands. It is an age in which tourists travel to Asia to see only the bar girls, and North America descends on Haiti for sex romps, not sightseeing tours. It is an explicit world. Full frontal on stage or full frontal between glossy magazine covers and hardcore on video. Christian morality, where it held sway, is stretched thin in its own defence, if it remains appropriate at all. The Puritans are in retreat. Sexuality is uncurbed, no longer morbidly hidden, unhealthy or undesirable. It is nothing to be coy about. Even the gay community in the last decade has come out of the closet and gained some public acceptance, amused or indifferent. Community tolerance grew accordingly. In comparison with San Francisco, Sydney was seen as the gay capital of Australia. Now it has been branded the AIDS capital of Australia.
We have an urgent need in Victoria for an Anti-Discrimination Act, similar to the one in New South Wales, that provides protection for gay people against unfair and unreasonable discrimination. And there's very important that those things be in place so that people have some recourse to protect themselves against discrimination. But I think, again, on the whole, most Australians are fair-minded enough and sensible enough to realise that there are no grounds for discrimination against gay people because of this situation.
The idea of compulsory blood tests for all citizens annually is starting to surface. Do you think it's a good idea?
No, I don't think that's a good idea. The blood test currently available is not a test for AIDS. It's only a test that indicates that someone has been in contact with the virus. It doesn't indicate that those people have AIDS or are likely to develop AIDS. We think the test is very good for using in the blood banks in order to keep the virus out of the blood system, and we think it's very useful for research purposes. We think mass screening, mass blood testing of people would only lead to unnecessary fear and alarm for a lot of people. It would lead to breaches of confidentiality and discrimination, and we're not in favour of that at the moment.
In Australia, 47 people have died of AIDS. 9 contracted the disease as haemophiliacs or through blood transfusions. 3 are classified unknown. The remaining 35 were homosexuals or bisexual. So in Melbourne, Adam Carr's work concentrates on the Victorian gay community. Tens of thousands of leaflets have been distributed. Regular education nights and so-called teach-ins are held at gay venues, while the gay community itself has raised $100,000 in 6 months to help with the campaign. Carr is assistant editor of the gay magazine Outrage, a paper, he says, that has been more responsible in its coverage of AIDS than the mainstream media.
Some sections of the media have been excellent in their coverage. Other sections have tended to sensationalise, to oversimplify, to cause unnecessary alarm. I think particularly the tabloid press and some radio commentators from time to time have been irresponsible and have caused quite unnecessary alarm and every time there's a screaming headline in the Sunday papers, for example, our phones run hot all the following week with people who are worried that they're going to catch AIDS from teacups and toilet seats and swimming pools and things for which there is absolutely no medical justification for those fears at all. And we have to pick up the pieces after that those media exercises, and I think that's a great pity that chasing ratings or chasing headlines causes that to happen.
But many, many people are frightened. It is not a disease confined exclusively to gay people. Bisexuals may spread AIDS. Intravenous drug users are at risk. In Africa, it affects men and women equally. In a recent poll, 78% of Australians held great concern about the disease. Technically, AIDS is an epidemic, but not in the sense of other viruses. It is not spread by normal social contact. One major priority of the National AIDS Task Force is to ward off community panic. Also at risk is the gay community itself, no longer as acceptable as it recently was. Are we likely to see antagonism towards homosexuals from the straight community?
That's possible. To some extent that's happened in some places in the United States, and it's happened on a smaller scale to some extent in Sydney, where there has been a noticeable increase in violence and harassment of gay men. I don't think it will necessarily happen. I think most Australians are sensible enough to realise that this is not a situation where anything is achieved by name-calling or by assigning blame, that this is a problem that the whole community faces, and that the only way it's going to be dealt with is by everybody exercising some tolerance and some understanding.
Sue Smith reporting, and I saw a few of you shaking heads a bit while we heard what that had to say, and I'll come to that in a moment, but could I ask you as a panel all of this? I'll come to you first, Professor Dwyer. Hundreds of people die every year of heart disease in Australia, and tobacco-related diseases and other major diseases. 47 so far of AIDS. Are we making too much of this disease?
Margaret, I think we are making much too much of this disease to put it into that perspective. Smoking related illness, heart disease is a much bigger problem for the public at large. So that in that sense we're making too much of it. But this is a dramatic disease, and it is a real challenge to us. It is affecting a significant number of our population, and it's appropriate that we do everything we can to try and combat the disease and learn more about it. But put it in perspective, even in our country, let alone worldwide, this is a minor problem.
Dr. Gould?
Yes, if I could just add one thing to that, is that AIDS is somewhat different from heart disease, smoking, alcohol, in that if, for instance, you have a minor attack of angina with heart disease, you can change your lifestyle. There's a chance of preventing it. There's a chance of not going on to getting a heart attack. Even if you've been smoking for 10 or 15 years, you can stop smoking, and we know that if you stop, your lung function improves fairly rapidly. You can stop drinking and your liver can recover. If you get infected with the AIDS virus just once, and it may take only one sexual contact to become infected, at the moment we can't get rid of the AIDS virus, and that virus may kill you. So it's somewhat different to heart disease and the other chronic illnesses that we're facing.
Very different indeed. Dennis Altman, is it a hysterical reaction in the community?
I think there's great hysteria, and I think what is most striking about the hysteria is that there is a total lack of compassion for the people who are actually sick and dying. We constantly hear stories about the great threat that AIDS poses. They're very rarely stories about the people who are already suffering. The stories seem to concentrate on the hypothetical and extremely unlikely threats to people who might fly on aeroplanes, might attend schools, might go into magistrates' courts. I think we have a very strange combination of unnecessary hysteria and lack of concern for the people who are actually in the hospitals.
Peculiar to Australia?
I think it's worse in Australia. I've just come back from spending 15 months in the States. What strikes me is the Australian media is, I would say, probably the most irresponsible in the world in their coverage of AIDS. And certainly, I think, the least professional. The level of reporting, even in our better newspapers and on the ABC, is really very, very bad.
It's depressing, isn't it? What do you say, Terry Goulden?
I can only agree with Dennis, especially on the level of reporting, and I think he's right insofar as it focuses on the sort of non-existent threat to the community, and it leaves out certainly all the people that I'm seeing with AIDS. It leaves out all the stories that I think would make very good news stories about their courage, about the way they've faced up to this disease, about the way they get even joy. They say they get joy out of this disease, even though they're terminally ill. I would like to see a lot more positive stories going out on the Australian media, and I think that they are news stories.
Well, one of the major complaints that you've made is this, not beat up, but this inaccuracy perhaps in the Australian media. And that has led to confusion, certainly in my mind, and I've read as much as possible about the disease, in what exactly AIDS is. Now, while I don't want to go back to square one, could I ask the two medical experts on the panel, how long has it been around and why is it different from other viruses, John Dwyer?
Well, Margaret, I'll answer that question, but I think it would not be reasonable to leave that first introductory topic without saying that Channel O, or the producers of this program, really did sink to the level that we're complaining about in the media with that dreadful introduction, with all the sexy pictures and the innuendos, etc. And my patient sitting at home with who are haemophiliacs with this disease, or someone who's innocently picked it up from a blood transfusion, who's hoping perhaps that the public will gain some insight into this and some sympathy. There it is again, all this innuendo and this mixture of death and sex, which is irresistible to the media. And with due respect, I think we must object to that sort of an introduction. Now, having got that off my chest, and probably everyone else would like to say something similar, let me answer your question, because it's an important question. AIDS is a disease. It's caused by a virus. The virus is a particular challenge to the medical profession and, of course, to the victims of the infection, because this is a virus which has properties that no other virus that has struck at humans has had before. And that property is that this virus has the ability to destroy absolutely completely the immune system, that is the defensive mechanisms of the person who's infected with it. In its worst form, people are left defenseless.
Dr. Gould, why in Africa, for instance, are women as susceptible to AIDS as men? Why is it different there from here?
I don't think that it's different in Africa. I think just simply that it started differently in Africa and different groups were affected. I don't think particularly that women or men are any more or less susceptible to the virus. I think in Africa what happened was that the virus probably started or mutated or changed in Africa possibly 15 years ago or around that time. The theory is that it occurred, this change occurred possibly in Zaire or Central Africa when there were immigrants that had come over from Haiti to work there, that there was a new population introduced, and sometime during the early 1970s or late 1960s the virus changed and was probably transmitted from the workers through contact with prostitutes to heterosexual men. In Africa at the moment, half the people infected are women and half are men.
Well, why the almost exclusive province of male homosexuals then, up till now?
Well, it certainly is true that in the Western world it's been mainly a problem for gay men, and I don't think that's really hard to understand. It's a matter of, in a particular society, where is the reservoir of the virus? And unfortunately for the gay community, the reservoir of this virus is, the major reservoir of this virus in our society, in the United States, is in gay men. Their lifestyle in recent years has, from a non-moralistic standpoint, a purely epidemiological standpoint, has made it relatively easy for this virus to be transmitted from one person to another. If we had as many heterosexual people carrying the virus, then it would spread just in here in Australia just the way it does in Africa. There's nothing magical, I think, about the sexual practices. It's just where the bulk of the virus is living right this moment.
I think we need to look at this epidemic in a much longer term perspective than just 3 or 4 or 5 years. We need to look at what's going to happen possibly over the next 10 or 15 or 20 years. There have been estimates made that it may take up to 15 years after infection with the virus until people start getting signs or symptoms. Now that may be an overestimate, but I think that as time goes on, we'll see spread of this virus outside the reservoir into other groups, and I think we're looking at it in a very short time span by saying that it is only in the homosexual community or only in a small community.
It isn't only, and I think that this is being overstressed. You said almost exclusively. In the United States, of course, 30% of the cases are not found among gay men.
But it did begin,
in Italy,
didn't it?
It was first noticed among gay men. It is perfectly possible that, of course, there were Haitians or drug users who were already sick with AIDS, but they did not have access to the sort of medical care that would allow people. In fact, there are the earliest documented cases, which people are now tracing back and saying conceivably were AIDS, were not necessarily among gay men, and the medical people will know this, but their cases...
And perhaps doctors looked at them and couldn't diagnose, and they died, and that was it.
The first case was actually, interestingly, in a Belgian woman surgeon who was working in Zaire
in
1976, and she'd then gone back to Belgium and had developed AIDS, and then her husband subsequently developed AIDS. And this was the first case that we know about. There may have been earlier cases, but it's interesting, it was actually in a female surgeon.
If you're looking at the epidemiology of it, then obviously it was transferred from Africa to Haiti by heterosexuals, because it was heterosexually carried at that point. And therefore it was only from Haiti that it moved into the gay community in the United States.
Dr. Gould, when you say we should look at it in the longer term, is it wild to suggest that there could be immunisation or a cure for this disease?
We certainly hope so. I mean, there are a lot of people working very long hours at the moment to try to find a cure and to try to develop a vaccine. As of today, it doesn't look particularly hopeful, but there certainly is a lot of very good research going on at the moment, and we would like to think that there's a cure.
But look, Margaret, I'm very sensitive, having taken part in a number of these programs and been followed up with various questions, that we have to be terribly careful when we quite accurately say to people, as Julian just did, that in the long term, this will involve more people and spread into the community, etc. To analyse that, because what is terribly important is that we don't mean this will spread the way a flu virus will spread. We don't believe that different modes of transmission will suddenly turn up. What we mean is that as there's quite a bit of casual sexual activity among heterosexual people, then inevitably, unless we can get on top of this, more people in those groups will be infected. But I'm sensitive that every time a medical person says something like this, we're likely to be turned around and accused of saying a black plague will spread throughout the community. We're not saying that for 1 minute. Yeah,
I can understand that. One very important question I consider is that we're told that in Sydney, for instance, so many tens of thousands of people are AIDS positive. They carry the AIDS, is that the correct terminology? They carry the AIDS virus. I want to know, will they eventually succumb to AIDS, or is there no chance of that?
So do we. We want to know that too.
We don't know the answer to that yet?
I don't think there's an answer to that at the moment. The evidence that we have from the United States is that a certain proportion of people that we've followed now for 4 or 5 years who we know are infected with the virus have gone on to get AIDS. Now, the longer we follow people, it seems that the higher that proportion is. But obviously, as with every infection, not everybody infected will go on to the end stage.
Yes.
And I think that only time will tell us what proportion will go on to get end-stage AIDS.
Could I just pick up something Professor Dwyer said, because I think it's terribly important. There's been attempts over and over again by people from the task force, by medical experts, to get across the message that one of the things that we do know is the route of transmission. It hasn't got through at all. I mean, I had this extraordinary experience of coming here tonight in a taxi, and the taxi driver, because he saw one of those banner headlines, started telling me how he was scared to accept a $2 bill from someone because it had been in their mouth and this was going to get him AIDS. And I said, this is nonsense. I'm a doctor, which I'm not. But I didn't want to explain why I happened to know it was nonsense, and reassured him that, yes, he could accept his fare. He didn't have to starve because of this fear. Now, the point is, I find over and over again in the press, I read very bad reporters saying things like, the routes of transmission are not known. But the reality is that I think we're, 99% certain of the routes of transmission. And the concomitant of that, of course, is that one of the things that can be done is that people can take measures to prevent AIDS being transmitted. And this is, I think, the crucial thing. And at a time when we don't have a cure, we don't have a vaccine, there are steps that are going on. Now, they're not being supported as well as they could be by governments, particularly in some of the states.
I think it's fair enough to take a shot at the media and say that the media has been irresponsible in its handling of this in the country, but what about conflicting information from authorities? Some authorities are extremely cautious, some are more bold. Now, if the media is getting mixed messages from the...
Margaret, one of the problems is the media accepts that anybody with a medical degree is an authority of equal weight. And one of the extraordinary things in this country is that somebody with, you know, a medical degree from the University of Paraguay who has specialised all their life in gastroenteritis, if they were to write an article on AIDS, this would be republished in half the newspapers of Australia.
Only if they said something dramatic,
right,
which looked like
and
it
if they promised death in large enough numbers.
Yes, I think Dennis is quite right, that, and Professor Dwyer, that we know how this disease is transmitted in almost every case. Now,
are authorities united in their knowledge, in their belief about the way the thing will go?
Oh, I think very much so.
Are they?
I think that the people who are aware, who deal with AIDS every day, who keep up with the literature, who are constantly in contact internationally with people working with this disease, are very sure about what we know.
Let's get on to the gay community, which has been involved and which I think in a lot of areas feels under siege. I don't know whether that's an extreme way of putting it, but how difficult has it been for the gay community? What sort of lifestyle changes have taken place?
I think considerable lifestyle changes have taken place, and I agree with you that there is some form of siege mentality, especially as, I mean, and I think Professor Dwyer gave a perfect example of that tonight when he talked about innocent victims. I mean, this is a virus. There are no innocent victims, and there are also no guilty victims, because that's the concomitant of the innocent victim theory, that all the gay men that I'm seeing, all the gay men that are in our group and who have AIDS, in some way have brought this disease on themselves, or deserve it in some way.
Well,
now,
I mean, that's been said by certain church leaders in the community too.
Yeah, and I know that it is extremely unfair that people with haemophilia, that babies and people who have blood transfusions get AIDS, but it is also extremely unfair that gay men get AIDS.
Yes, absolutely.
And so, I mean, we must learn not to use these pejorative labels and set up the siege mentality.
Who's the best person to counsel AIDS sufferers in the gay community?
The best person, I would say, gay people. I would say we understand the situation, we understand the coming out process for gay people, which is so essential in this process. We understand the lifestyle changes, and we can speak frankly.
Margaret, I won't disagree with that, because, and I'm not sure that actually that when I finish that Terry will disagree with it, but I ran an AIDS clinic in America for 4 years. More than 400 people with various stages of the disease were counselled and treated. And I'm absolutely of the opinion that no one person can counsel anyone.
I didn't mean
AIDS.
one person, I meant a group of people.
I think, the point is, I think it needs a team effort. I think certainly you need to have gay counselling help people who understand it. But I think it has to be a team effort. And places like Julian's Albion Street Clinic, where they've got a team of people together, can really supply a service. I think victims of the disease need to have that group expertise to handle various aspects of it. There's so many ramifications of this disease.
And we've found, in addition to that, that while there is no magic pill that people expect to take 4 times a day and will cure everything, that by proper counselling, by changing people's lifestyle, by improving their health, their general health, by cutting down on their stress, by getting exercise, by simple measures that we try to teach people who come to the clinic, in a team situation, in a group situation or a face-to-face situation, we believe that we're making advances in stopping people from going on to get the end stage of the disease. We think it's a very positive way of approaching this disease rather than just telling people there's nothing to do. We've now seen 1,500 people go through that clinic in about 3 months.
Yes, Terry Goulden, I was going to say to you, it's a bit, is it elitist, do you think, to say that only gays can counsel gays?
No, I disagree with that, because I'm not talking about the medical aspects, and we work, in fact, in a medical team. But when the first case was diagnosed in St Vincent's, the first thing they did was to ask the gay community to supply counsellors who could understand the special needs of those people.
I think sorry, Terry, I think I would actually disagree to some extent with what you're saying, because my experience of programs in the States suggests that a surprising number of non-gay people have become involved working as counsellors. But the real point I want to make is the other side, that the way things are set up, nobody is available except gay people to provide a lot of the services and a lot of the counselling. And as one would expect, I guess the epidemiologist would agree with me on this, an increasing number of cases to show up among drug users who do not have any community and who have even greater stigma in this society than homosexuals, except perhaps in Queensland, where I guess we're equal last. We, as a gay community, are going to be picking up burdens and looking after other people. I mean, Gay Men's Health Crisis in New York is running social welfare programs for large numbers of people who are not gay, because nobody else will do it.
Yeah. That's very true. In my unit at Yale University, we ended up having many experienced gay counsellors who were of tremendous use to the haemophiliacs and other people, and were very compassionate about it. But it is true also, Terry, that a lot of gay people do not want to be counselled by gay people. And many, while I couldn't run an AIDS clinic without gay counsellors, because most do, there's a sizable proportion of them that do not want to get involved with gay counselling groups and the support groups that have been set up. And I think these people have to be catered to too. So it's a...
I would have to agree with that. I'm perhaps being a little extreme on that point, but in fact, our Ankali project encourages heterosexuals to join us.
In this country, it isn't, in fact, just gay people who act as counsellors. Nursing staff at Melbourne's Fairfield Infectious Diseases Hospital underwent special training for the role.
We had quite a deal of education of the nursing staff right at the beginning of the sort of AIDS epidemic, as we sort of see it. And a lot of that was on a very sort of informal basis. We set up coffee shop sessions where nurses were just encouraged to sort of drop in, sit down on the floor on a cushion, have a cup of coffee and chat about issues and concerns to them. And nurses at all levels, from the trainee enrolled nurses right through to myself, joined in those sessions. We were joined by the chief social worker, and we gained a great deal of sharing concerns with one another. We learned where we recognised that we lacked the degree of skill that was required. We felt very much that here we had a very vulnerable group of patients who needed a great deal. We wanted to provide it, but we didn't want to be learning on this vulnerable group of patients. So we established sessions, and we did have professional people come and talk to us about sexuality in general and homosexuality in particular. And that helped quite a good deal to prepare nurses for some of the stresses that they were perhaps going to sort of face in their day-to-day sort of involvement with the patient.
Is it more depressing nursing AIDS victims than other people who are dying or terminally ill?
It depends what you say is depressing, and I think that really depends on your own philosophy and your own sense of caring, your own beliefs about death. It's not easy to nurse patients who are dying, but really, perhaps the thing that makes it more difficult to nurse patients with AIDS who are dying is their age group, the fact that they tend not to come into hospital once with an acute severe illness and die, but they come backwards and forwards several times, and they more or less sort of see them on an inevitable sort of treadmill that, you know, each time they come back brings them close to the time that they inevitably will die. I know that I feel some degree of distress when I look at the admission book each morning and I note familiar names of patients that have come back again. You think, oh dear. And if that's affecting me in that way, it's obviously affecting the nursing staff who are nursing those patients and are very, very close to them. I sort of know the patients, but I have nowhere near the degree of close contact that the nurse does.
Your staff must find this emotionally exhausting.
They find it emotionally very exhausting. And, but none of them have said, I don't want to stay on the ward.
Have you found nursing AIDS patients professionally rewarding?
Yes, I have. I've found that it has been something that has been very professionally rewarding, and that I believe that I and members of the staff have developed professionally, grown professionally a great deal over the last 12 months. I don't think I would have believed 12 months ago that it was possible for us to have really achieved this, to have had so much sort of sensitivity, understanding of the needs of this group of patients. But it has been achieved. To a great deal it's been achieved because the staff members have been so prepared to be involved. We've gained mutual respect for one another, and both of us are very much more sensitive to the sort of philosophies and the sort of issues and the concerns of one another, and that can only be to our benefit and to the benefit of our patients in the future.
Sue Smith reporting. I'd like to move on to the law and AIDS and whether the panel feels the law has to be changed drastically. There have been lots of propositions put. I could put some of them to you and see how you feel about them. For instance, should we enforce people who are AIDS positive to inform health authorities, do you believe?
Well, if I can make a comment on that first. Firstly, AIDS as the end-stage disease, Category A AIDS, as we know it, is a reportable disease in every state of Australia now, and that's been for almost 2 years. And it is a reportable disease.
What about those thousands of people who have a positive test but don't have the disease?
Well, I think it's very important to look at the groups that are affected at the moment. Homosexual men, intravenous drug users and prostitutes are classically groups in society that have lived, if you like, on the fringes of legislation, and they're classically and will remain people who will respond very negatively to any legislation that is introduced. And I think at this stage of the disease, we must be looking at encouraging those people to come in and be tested, because it's only by being tested that we can do anything for them. Now, if any legislation is introduced which is going to make them afraid or discourage them or make them apprehensive in any way, then I think it's very negative, because the result of that is that they'll only come in at the end stage of the disease into hospital when it's too late for us to do anything.
Does everybody agree with that?
Yes, the attempts to sort of legislate control of AIDS in America were a uniform disaster. There's no place for legislative attack on AIDS. I couldn't agree more.
There is, however, one very major change in the law that is needed, and that is in those states where homosexuality remains a crime, Queensland, Tasmania, and I think still WA, Terry?
Yes.
Yeah, so in 3 states, where for somebody to go to the equivalent of Julian's clinic and to give their medical history
is an admission to being a criminal.
Exactly. If there were any real concern by the governments of those 3 states for really preventing the spread of AIDS, then they would be rushing through emergency legislation immediately. The second law change I'd like to see is equivalent to the measures just adopted in the city of Los Angeles, namely to protect people with AIDS against unnecessary discrimination. Now,
I was going to say, I think that's a fascinating point that you make, because the ambivalence in governments in this country and the inconsistencies around the country just add to the problem.
I think it's important to pay tribute to the federal government. I think the federal government, by international standards, have handled this very, very well. And I think that only the Dutch government really comes close to matching them. And I think it's important we say this and give them credit where it's due. And then I think the states, you know, we really go from the best, which is probably Victoria, to the worst, which is Queensland. And I might say that when I was in San Francisco, a representative of the Queensland government came through, and people told horror stories for months around the AIDS world in San Francisco about what is going on in Queensland. They could not believe that in the 1980s in a Western society, governments were actually saying we will not sit on committees with homosexuals on them, irrespective of what this would mean in terms of developing any real sort of program to deal with this disease.
I think if we force this disease underground by people not coming in to be tested, the next time it surfaces in Australia, it will really be out of control. I mean, we do have an opportunity now to control the spread of AIDS.
Would you suggest that all people who'd led a reasonably relaxed gay life before 1981 or 2 should have a test?
What do you mean by relaxed lifestyle?
I mean that they perhaps weren't living in a monogamous relationship with an individual for 20 years previously, or 10 years previously. I mean, we all know gay couples who've been together for many, many years, but part of the gay lifestyle I've always understood for a certain proportion of the gay community is to have multiple partners. Now, would you suggest that they have tests?
Yes, I would. I think that at the moment, or for the future, anybody who comes in to be tested, we can guarantee them absolute confidentiality. There's no problem and no concern about confidentiality or privacy at all. And I think that it's only by being tested that people can know whether or not they're carrying the virus. And
that has implications far beyond just controlling the spread of the disease, because we're convinced that early diagnosis in people may actually be of help to the individual.
Do you see bisexual men who have been secretive about their lifestyle with, for instance, their female partner, their wife or their girlfriend, as being a particular case?
Well, I don't... all I think I can say about that is that the bisexual man should realise he's in a risk group and be tested as well. It may, in certain circumstances, be more difficult if he's been leading a secret double life. Most of the bisexual people that I have dealt with, not all of them, but most of them are quite open about their bisexuality, and quite often their spouse knows all about it.
Sure. I know a lot of gays, though, who are frightened to have the test.
It's really essential that we look at that on one hand the government's asking gay people to be responsible. Now, the most responsible thing a person can do is to be tested and know their antibody status and know whether they can transmit the disease or not. Yet, on the other hand, they're talking about legislation which says to gay people, we don't care about you, all we want to do is stop you from transmitting this disease into the general community.
If we're concerned about the spread of the disease through prostitution, shouldn't we, I mean, we have ambivalence all along the line, don't we? Shouldn't we be perhaps setting up a women's health service in King's Cross or wherever?
They've been trying for years, and the government has not supported it.
Unless government's prepared to do that, the ambivalence remains, doesn't it?
Well, I mean, we've been trying to, we send people out to encourage prostitutes to come into the clinic to be tested. You know, we have counsellors, both men and women counsellors, to try to encourage people. But while there's this fear of legislation, punishment, jail that's hanging over people's heads, which is based on the knowledge of whether or not they're antibody positive, people won't come in to be tested.
I'm concerned when I read that places like the City of Florida is using AIDS tests to screen all job applicants.
Well, you should be concerned about that sort of thing. Any time that people try and enforce legislatively protective measures like that, you're in for big trouble. The civil libertarians will have a field day. Fortunately, I don't think that's going to happen in most of the states in Australia. That's not the way to go. The way to go is to educate people.
What do you think of the setting up of a private blood bank, as Dr. Earl Hackett is doing?
I think the setting up of a private blood bank is unnecessary, and I see it as unfortunate opportunism. I think that all that sort of publicity does is detract from what may be a great technological breakthrough if they really can store blood for 10 years, and I haven't seen the data that convinces me yet. But it suggests to people that the blood banking system is still not safe, and I think that is very unfortunate, because there is excellent evidence to suggest now that we really can say that the blood supply, the regular blood bank blood supply, is perfectly safe.
Nowadays. What about in the past? And what about the person who had the transfusion 3 years ago?
Well, the person who had a blood transfusion 3 years ago may not be safe, but you have to look at the actuarial risks involved of all the millions of blood transfusions that go on versus the extremely small number of cases of AIDS. So that you have a much better chance of winning the lottery than you have of getting AIDS if you had a blood transfusion in the last 5 years. But there have been tragedies in the past with the blood transfusion service, with artificial insemination, etc. But our job is to make sure that people realise that we are progressing with our control of this disease, and the blood banking situation is now safe.
Just before we end, I'd like to ask you all about the media's role. You've all had a go at the media. How can the media improve its way of dealing with AIDS in this country?
I don't object to the media giving AIDS attention, but I think that there are two things that should be done. The first is, I think it has to be recognised by the people who run both print and electronic media, that this is a very complex story. You cannot just give this story to a new cub reporter every week and expect them to write intelligently about it. We just don't seem to have developed in this country, as is the case in the United States, medical reporters who have over the last few years followed this story and therefore have some way of judging what happens. I mean, the classic case was this reprinting of that long article by that crazy man Searle, because the editors don't know who he is and they don't have anyone on staff to say, is it worth devoting a page to the ramblings of an old venereologist in England? So that's the first thing. And the second thing is I would like to see, and this really follows on something Terry's also said, I'd like to see the newspapers and indeed the politicians and particularly the clergy show some real compassion. A lot of people are dying. A lot of people are grieving, and a lot more people are going to be dying and grieving. I don't hear any words about that. I mean, if there's a car accident and 3 people are killed, there are crocodile tears across the front pages of the paper. I would like to see some real expressions of concern. I would like to see Mr. Hawke and Mr. Rann and the Cardinal Archbishop of Sydney get up and say they care about the fact that young people are dying rapidly of a disease. When we hear that, I think the media will have something more positive to report.
Final comments from you.
Reporters must learn about what's going on. I mean, it's very frustrating to have a reporter ring me up after I work, you know, 16 or 18 hours a day on AIDS and say, I don't really know anything about it, but I have to have a story, and in 2 hours, please tell me all about AIDS. You know, it's not an appropriate way to go. The media must become more educated and write more intelligent articles.
Professor Dwyer, your final comments, not necessarily on the media, but on the story.
Well, just on the media, I think we have a attitude in some of the media that the public is enjoying a good horror movie and they like being a little bit scared, and let's keep fueling that fire, unfortunately. Now, I'd like to go on a positive note. I think that people should realize that compared to what we knew a year ago, we know so much more about this disease. There are so many good brains at work on it that I'm confident that there'll be big breakthroughs in the next few years, especially in keeping people alive long enough so that they are around to take advantage of the cures when they come along. And the picture is not all black. We have in this country, I think, responded very well to the challenge and set up screening and counselling services in most states that are adequate, especially here in New South Wales. It's not an all-black picture, and I don't want people to leave us tonight thinking that there's no sun breaking through the clouds.
Final from you, Terry Goulden.
Well, the best thing I can probably report is, in fact, what the people with AIDS themselves think about the media. We asked them this, in fact, for other reasons last Wednesday night in the group. And they said that they'd given up reading the media on AIDS because it didn't have anything for them. It didn't talk about breakthroughs. It didn't talk about new research. It didn't talk about how people with AIDS are handling their disease. It didn't talk about anything that concerned them. So ultimately, it really comes down to the fact that they found the media boring.
Well, I don't think tonight's been boring at all. Certainly not for me, and I hope not for you. Thanks, panel, for joining us for tonight's discussion.
Thank you, Mary.
And I'll be back next Monday night with another Issues 85. I'll look forward to that. Bye for now.